Hi, this is your Houston Chiropractor, and we have Wendy with us here today from Chicago, and she just flew in, so we welcome her to Houston. Kind of a nasty, weathery day out there today, but it's been beautiful all last week. So Wendy comes down here with hiatal hernia complaints, acid reflux, and the pressure, the acid, the palpitating heart, all the symptoms that come along with that. Is there anything else that you have with that?
No, I think you
That's
got it. Yeah.
Okay, that's plenty, huh?
Yeah, that's more than enough.
Yeah, I'm going to take a look here. So she's letting us video her very first visit, and then we'll do her last one to show you her progress. So Wendy, I'm going to have you close your eyes and flex your head forward and then backwards, please. There we go. And then back to neutral. There you go. Take a deep breath in for me. Let all of your air out, and just relax now. So for all of you who sit out there for a living, you might want to consider getting a sit-stand desk, which is the Desk makes the very best ones, sit-stand workstations. Because sitting for a living is probably one of the #1 health hazards in America today. Now, in looking at Wendy's posture, you can see her head's a little bit forward, and it's also translated a little bit to the left, which is elevating her right shoulder a little bit, and her pelvis is shifted a little bit to the left. You can take a look at that. You see how you're a little bit left here, and your right shoulder is a little higher. Your shirt's uneven there, and your left pelvis, you have no room here versus you have a little bit here. Okay, good. So let's go on your back for me. Now this is the initial examination, and this is what I do on every patient who comes in here, no matter what their problems are. So I'm going to do an orthopedic neurological test on you now. So tell me if you have any back pain or shooting leg pain besides the tightness in your hamstrings.
Just tightness.
Okay. And is there any leg pain or back pain when I do that? Good. So she's got a negative straight leg or negative braggart, so I'm going to push down. Is there any hip pain or back pain when I do this? Hip. Okay, that's a positive Fabry-Patrick test on the right. Let me do the same thing on the left. Positive Fabry-Patrick indicates a hip problem itself. Tightness, no pain though. Okay. And you pain your back or leg when you do that? No. Okay. Let's do this. Now I'm gonna push down here. Is there any hip pain on this side? Is it like deep in here? Okay, that's hip pain. So she has a positive Fabry-Patrick bilaterally, which indicates that she has some actual hip joint problems. So I'm going to test her lower nerve roots now. Push against me. Pull up. Turn in. Turn out. Good. Push your big toe down. Push your big toe up. Good. Push. Pull up. Turn in. And turn out. And big toe push. Little big toe up. Good. Okay. So let's have you sit up sideways and face towards your navel. There we go. Okay, I'm going to push straight down. You tell me if this hurts your neck or spine anywhere. Okay, now we're going to go backwards into the right and down. How about that one? Okay, that's a positive maximum foraminal compression test on the right. That hurt? Same place? Yeah, okay. How about when you just tilt your head to the right? Does that cause that same tightness or pain? No. How about when I do this? Does that cause any? Same place? How about when you tilt left?
No.
Anything there? Okay, so you got positive shoulder depressor tests on positive on both sides. Now just turn left like you're looking left for me. Okay, now turn right like you're looking right. This is the way you sleep all the time, isn't it? With your head turned that way.
Yeah, I used to.
So for you stomach inside sleepers, that'll get you out of place. I'm going to push down now, resist. Okay, that's deltoid, that's C5. Hold, good. Yes. Deltoid C5 is good on both sides. In muscle testing terms, that's a grade 5. Okay, I'm pull, resist. Okay, relax. Now I'm going to push in, test your triceps, resist. Excellent. So I'm testing C5, 6, and 7. Now biceps C6, triceps C7. There we go. That's the motor component. So we also check the reflexes in those same nerves. C6, C7, C7. Reflexes are good. +2 equal and active in her upper extremities. Yeah, her patellar reflex is fine on both sides. +2 equal and active. And just relax your foot. There we go. Okay. Good. Now, can you just walk on your tiptoes about 3 steps that way? Good. Now your heels only. Yeah, back towards me. Perfect. Okay, you can stop right there. If you were going to bend over like you're going to touch the floor, tell me if and when that hurts anywhere.
Okay.
Okay. Okay. Any back pain?
No.
Nope. Okay, just tighten your hamstrings and your legs. Okay. Now, if you were to keep your knees straight and lean backwards, does this cause any pain in your spine anywhere? Including up in here. Just lower back? Okay. So I'm going to have her cross her arms here. We're going to lean backwards, and I'm going to have you twist left now. And if I push down, does that increase any pain anywhere? Increase it?
Not really.
Okay, and then if we go backwards into the right and pull down, does that increase the pain anywhere? Okay, excellent, good. Let's say if we lay down on your tummy here next. Now, we don't really treat people for acid reflux or hiatal hernia per se. We treat people for what's causing it to happen in the first place, which is usually biomechanical in nature. See here in this position, her right leg is short by 1/2 inch. Now when I bring them up, it gets even. I bet you that tightens up in your thighs and your low back.
Yep.
So her right sacroiliac joint is out here. She has a positive knotless in Deerfield. She had pain, tightness in her lower back, plus her pelvis raised off the table. That's a positive knotless. Deerfield's when her leg gets even, when it's short. That tells me she doesn't have anatomical short leg. That's tender right there, huh? Probably on both sides, actually. Right one worse. And there's L5, that's sore. L4 sore, L3 sore. All this is sore. Ooh, there. That's really tender right through here. Usually you'll find when someone has a hiatal hernia that the paraspinal musculature from the mid-thoracics all the way down into the lower thoracics and upper lumbars is very hypertonic or over tight, in other words. Tear all through here, huh?
Yes.
And when you get that shooting pain straight through, you feel it through here a lot and then right through here. See, T5, T6 supplies the stomach itself. And that's not the reason people have hiatal hernia, is the stomach acid being too much. It's that the stomach acid is being secreted up into the esophagus where it burns. And that's acid reflux or hiatal hernia. Okay, tender right there as well. Her atlas is out on the right under her skull. C5 and C6 are also on the right. That's where you have some pain in your shoulder blades too, right there, huh? Okay, I want to have you lock your whole leg straight and lift your whole right leg off the table. Okay, good. Let's do the same thing on the left side now. Yeah, this one felt harder, didn't it? Didn't go up as high either. So she has a posterior right or left sacrum right there. Is that tender at all right there?
Yeah.
Not too bad, not as bad as this one. Is the right one worse over here, or is this one?
I think that one.
This one right here. Yeah, her sacrum is out. I think this is probably what you were talking about a while ago in your history. It's your low back and pelvis, your sacrum. That's the middle triangular shaped bone in the pelvis. Okay, you ready to feel better?
Yes.
So we have determined that she has biomechanical issues in her pelvis, in her lumbar spine, in her lower thoracic, upper lumbar spine, and mid-thoracic spine, as well as her upper thoracic neck. So we're going to adjust every single aspect of her spine and pelvis. I'm going to start with the right SI joint. And it's internally rotating. So we're adjusting it external. There. And then her sacrum, we're adjusting it straight superior to inferior. But then when we get on the left side, I'll be adjusting it straight superior to inferior and also down in the Z-axis. So she has a posterior left sacrum. There we go. Yeah. Here's L5. It's pretty much straight P to A work in the Z-axis. L4. L3, that was probably pretty tender right there too. Yeah, L2 as well. There's L1. Now I'm going to put your head down just a little bit here. There we go. Wendy is from the Windy City. I bet you hear a lot of that joke. Chicago. I'm from Illinois as well. But I'm from the opposite end of the state, down in southern Illinois. There we go. It's where I grew up. There's actually more people in our building here in the little town I grew up in. Tender right there at L5 still. There we go. Good. Now, let's check your leg length again. Yep, you're exactly even now, and I bet you this feels easier coming up this time. It stays even that time. Yep. Good. So, this being her first visit, I'm not going to get the turbinator out on her yet. But we are going to start stimulating the circulation in her pelvis and in her paraspinal muscles all the way up and down. You probably get sore right out here on the sides of your thighs occasionally too. Your pelvis being out. Now I'm going to put your head down just a little bit more here. Scoot up in there just a tad for me. There you go. Now we're going to adjust her lower thoracics. And just exhale. There we go. Okay. Yeah, you're tight, all right. Okay. Just keep exhaling for me. Okay. There's still one right here. I can feel it. There it is. I knew it was there. Okay. Now this should even feel easier, Wendy, this time. Better? Good. Okay, so she's got some pretty significant paraspinal muscle spasm right here in the thoracolumbar region. I'm going to work on this with my elbow. This is going to be one of those hurt so good things, Wendy. It's going to be really tight and tense and probably a little painful at first, but it'll feel a lot better when it quits hurting. Yeah, see, that's tender right there, huh? Now, you probably even feel this deep down your gut when I'm doing this. This is called somatovisceral reflex from your muscles to your organs. Because the nerves that supply these muscles also supply the organs that correspond to the same nerve. So therefore, somato meaning muscle, visceral meaning organ, reflex. You get visceral-somatic reflex too, which means that the organs reflex to these muscles. So that's why these guys get so tight. It becomes a vicious cycle. You probably noticed that throughout time in the last couple of years, huh? That when your tummy hurts worse, your back hurts worse, and when your back hurts worse, your tummy hurts worse.
Yep.
Yeah, right there. Big time worse, huh? That's the worst spot right there. Okay. So by doing this, not only are we causing Wendy to hurt, but we're actually relaxing these muscles so that when I do the work on the rib cage, which I'm going to do here next, she'll actually get a better result from that, where the ribs will hold better with the thoracic spine alignment. That will strengthen up her diaphragm, which is what holds the stomach down below in the lower cavity where it's supposed to be, rather than letting it slip up into the upper cavity and secrete acid into the esophagus. That's why you get all that pressure feeling, and a lot of chest pain accompanies hiatal hernia or acid reflux as well. Ooh boy. Okay, I'll be nice now. Okay, let's turn on your back now. Yeah. First one's always the worst one. Okay, let's get you up this way just a little bit more, Wendy. There you go. Okay, yeah, that's perfect. Let's let your head go right in my hand. That's good. Excellent. Well, that's a good master cervical rotary break. Then we get her shoulders here. Okay, now, let's check the rib alignment here. Now see, her ribs aren't that bad compared to a lot of our patients that have this condition. So take a look here where my thumbs are. Wendy, can you see down here? See how this left one, or this, yes, the right side, or left side over here is a little higher, about 1/4 of an inch than this side, but not bad actually. So I'm going to have you take a deep breath in. Let all your air out. Now I'm going to go down deep in here, and I'm going to grab the fundus, or the top of the stomach, and I'm going to pull that straight down while you're exhaling. Keep exhaling. There you go. Good. Okay. Now, another deep one. And let me sink in here. Keep exhaling. You notice I almost have a martial arts stance when I'm doing this, and I'm grabbing the top of the stomach and I'm pulling straight down, and I'm also pushing it down here with my pisiform. Another deep one. And exhale. And a lot of times when we first start doing this, you'll feel that hard nodule down in there. You feel that right there while I'm on it? There we go. Okay. Now also, people that have hiatal hernia or acid reflux oftentimes have ileocecal valve problems as well, like right in there. Does it ever bother you? Do you eat popcorn or nuts or things with husk on them? Corn on the cob, stuff like that. There's a lot of corn up in Iowa and Illinois. A lot of good pheasant hunting up there too. I used to go pheasant hunting in Davenport all the time when I went to Palmer. And over here is a valve between the large intestine and the colon. Sometimes it gets stopped up too. So when you do adjust patients that have hiatal hernia, we usually do some colon massage on them as well. And you'll feel some little gurgles down in here when we do this. And you've been doing this to yourself a little bit too, right? Good. You have an advantage over a lot because you're already a massage therapist, so you understand a lot of this stuff. Okay, now we're going to check her knee stability, which is not bad. She got a little bit of laxity there, but you should have felt that in your knee and your low back, did you? Okay. And let's check on the left one here now. Perfect. Good job. Should have felt that in your knee and low back as well. Good. Let's sit you up, face towards your navel here. There you go. Okay. Now we're going to just check her right shoulder. She doesn't have a lot of crepitus over here, so that's good. There's her glenohumeral joint on the right. You got a little more crepitus on this left side. See that? There we go. That's the left glenohumeral joint. Now we're going to adjust the ulna and the radius and ulna. The olecranon process back here. And then the wrist. Right there. Each one of the digits we pull straight out. Now I adjust the wrist again by compressing the radius and ulna and carpals and pulling straight out simultaneously. This opens up the carpal tunnel. For all of you who work on a computer and use the mouse a lot, you notice that your wrists hurt sometimes, and sometimes your forearms as well. Shoulders and arms. There we go. Good. Okay, now let's have you come over here in front of the mirror. And we're going to adjust her with the Atlas-specific instrument on the x-axis. So I'm going to have you close your eyes again, Wendy, and flex your head forward and backwards, please. And then neutral. Yep. Yep, take a look at the difference already.
Yeah.
You're right in the center now.
Right.
And your pelvis is also centered up better too. So your home exercise is this. You're going to lift up with your traps, pull back with your rhomboids simultaneously, keeping your shoulders up high. Pull these way back. See how it tightens up your whole trap? Then we want to bring your head straight back. Now you were a little bit over to the right, so we're going to pull you a little bit left and then straight up to the ceiling and shift your pelvis straight right now. Hold that right there for just a moment. Feel a little tap on your atlas there. Atlas there. And while she's in this position, I'm going to hit her lower thoracic vertebrae, paraspinal muscles. This is not adjusting them. This is just bouncing the muscle spindles in the paraspinal muscles. You can relax. When you go forward and backwards this time, Wendy, it should feel smoother. Try it and see.
Yes.
Should feel like it's on a swivel.
Mhm.
Excellent. Take a look at your posture now. Much better. See how
Yeah.
your hands are more at your side too?
Right. Yeah, and there's space.
Yeah, equal space on both sides, shoulders are level. That's great. So this is the first visit. We're going to be seeing Wendy twice a day for these next 4 days, so you get to see her last visit and maybe a couple in between. This is your Houston chiropractor. We'll see you next time.